Congressman Andy Barr joins us now live. Congressman, welcome. Let's talk about a federal loan program from the SBA, the Economic Injury Disaster Loan Program, so crucial to small business owners. They're getting to open up here in Kentucky during the next month, and they need money to do that. They've not had any revenue for 1 or 2 months. Yet business owners here in Kentucky tell me they applied 2 months ago and they've received little or no money from this federal program. What's taking so long?
Well, thanks for inviting me to be with you, Sam. And this Economic Injury Disaster Loan Program is part of the fourth of 4 responses from the federal government. And it wasn't funded in the first 3 phases, but it was in the 4th phase. And it is not really the centerpiece of the federal response, but because the Paycheck Protection Program was not reaching all of the small businesses, Congress decided to fund this program at $50 billion in loans and then $10 billion in grants. But this is just one part of a very comprehensive, whole of government, powerful fiscal and monetary response that comes in response to this unprecedented government-imposed shutdown of our economy to respond to this public health emergency. Those EIDL loans and grants should be coming online now. But what we have seen as a very successful part of the federal response is the Paycheck Protection Loan Program, a forgivable loan program that has injected over $500 billion in forgivable loans to American small businesses, to over 3.8 million small businesses across the country. Those loans are totally forgivable if those small businesses keep their workers on the payroll. And so I see that as a big success.
60 Minutes just aired a report Sunday on rural hospitals in Texas fighting to stay open, some filing for bankruptcy. What can you tell the leaders of rural hospitals here in your home state of Kentucky about federal help for them?
Well, we've been in contact with the provider community and hospitals and many rural hospitals who have been suffering not because they've been dealing with an overwhelming number of COVID patients, but instead because they've had to sacrifice shutting down elective procedures in order to conserve scarce personal protective equipment for those tertiary hospitals, the large urban hospitals where most of the COVID patients are sent. So Congress, again, as part of these 4 phases, has provided a very powerful and aggressive, robust response to help the healthcare system, to provide greater resiliency and support. So $100 billion from the CARES Act went to our hospitals, both rural hospitals and those hospitals that are responding, treating COVID patients. And then the additional phase, what's called the 3.5 bill, the Paycheck Protection and Healthcare Enhancement Act, that provided an additional $75 billion for providers and especially rural hospitals. We're seeing this week the first tranche, $10 billion going directly to those rural hospitals to compensate them for having to shut down and conserve personal protective equipment.
Let's talk about stimulus checks to wrap this up. President Trump recently said we could very well do a second round of direct payments. It's absolutely under serious consideration. Do you see a second round realistically of stimulus checks for Americans?
It's possible. It just depends on whether or not we are able to open up safely. And many states are opening up the economy and doing so consistent with the federal guidelines, phase 1, 2, and 3. And as long as we continue to engage in healthy habits, social distancing, wearing masks, I believe it is time that we can open up the economy safely. And that gets people back to work. And what we've done so importantly with the PPP loan program is even though businesses have been shut down, many employees have been able to come back to work or stay on the payroll. Obviously, we've seen 30 million Americans have to file for unemployment. But as we reopen the economy, the goal is that we keep employees connected to their employers so that they can restart the economy quickly so that we don't have to provide additional support in terms of unemployment and additional support in terms of checks. We will be there if we need to be, but I think we've done well in this country so far, flattening the curve and getting on the back end of it. And so it's time to reopen the economy safely and get people back to work so that we don't have to continue to borrow money.
Congressman Andy Barr, thank you for your time tonight. We appreciate it.
Good to be with you.